February is nationally recognized as American Heart Month. Of course, it's time to raise awareness about heart health and heart disease, given that it's the #1 killer of both men and women in the U.S. But this morning, we specifically want to highlight men's heart health because being a man, I feel like I'm not being too untoward and saying sometimes we are not doing as good of a job as we can be about maintaining our health, especially our heart health. Joining me right now in Studio 61, I'm happy to have Dr. Hasib Kazi with Trinity Health of New England to talk more about what we can do to protect ourselves. Doctor, thank you so much for taking the time to join me.
Thank you so much for having me. Good morning.
Yes. First of all, how much of protecting your heart is that? It's doing preventative measures as opposed to just taking care of any problems that do pop up.
No, I think it's very important, first of all, to be taking care of yourself. And I think what I tell my patients is prevention is the key. Yeah. Because once you are diagnosed with a heart condition, taking care of it becomes quite an nuisance. And I think it's very important to prevent yourself from developing significant risk factors so that it can progress to heart disease. What is more important is, staying healthy, staying fit, and staying more active. And I think one of the biggest risk factors that we can modify on a daily is basically being more active. Mm-hmm. American Heart Association actually recommends that patients should have around 150 minutes of moderate activity in a week. Yeah. And you don't have to do it on a single day. You can actually do that activity over a course of a week. What I tell my patients is basically doing 30 minutes of moderate activity at least 5 times a week. And I think that itself can make a big difference.
This may seem like an odd question, but outside of that, I worry that sometimes people will take 30 minutes to go to the gym and then spend the rest of their day and the rest of their workday sitting on their butts. And that might counteract 30 minutes of exercise. How much is just generally getting up and being active, even on a light sense, doing housework? How much does that help?
Not just that, even gardening, I think, is that. And if you have stairs in the house, you can go up and down the flight of stairs. And I think that itself is a key. Just sitting on a couch, I think, is something that negates most of the activity you do in a day, especially when you're watching sports. But that's why you have those commercials. Stand up and get moving.
Right. You can use a Stairmaster at the gym. Watch the sports there too. What about risk factors? How many risk factors are there in terms of genetics?
So the one thing that actually offsets genetics is lifestyle. Mm-hmm. And the things to watch out when you're talking about significant risk factors, especially when it pertains to men's health, is your weight. I think that is a big risk factor. Sure. You're watching your cholesterol. Most of my patients don't know their cholesterol numbers at baseline. And then watching your blood pressure. I think that is a very important key. I see so many patients that come in and they're on multiple medications, and the only time they actually check their blood pressure is when they go to a doctor's office. And I think if we change that, and then we try to check blood pressure at least once or twice a week when you're calm, comfortable, you're checking your blood pressure, just to keep an eye on that number.
Yeah, my understanding is it's not always the easiest thing to check in a doctor's office because just being there could raise your blood pressure a little bit just because of nervousness, things like that, like white coat hypertension, I think, right?
Yeah, just sitting in the waiting room, seeing a lot of sick patients. Some patients are like running late to the clinic, just rushing up to it. So what I tell my patients is you should check your blood pressure when you're sitting in a controlled, calm environment at your house and keep a log of it. I think the most important thing is just writing down that number, because when you come to your doctor's office, having a log of your blood pressure numbers can actually help your doctor adjust your medications.
Now, we've talked about prevention, we've talked about risk factors. What about signs and symptoms of a heart attack? I do worry that's something that people see on TV. They think it's always pain in the left arm, always this crushing chest pain. And I'm not saying it's not, but I feel like, especially amongst men and women, the symptoms are more varied and different from men to women.
I think one important thing is when you're having chest pain, it shouldn't just be just crushing chest pain in your chest. It could radiate to your jaw. It could radiate down your arm. But just sudden onset of just feeling short of breath and not having enough breathing, and you're having trouble breathing. And then a lot of times, especially you can have vague symptoms of just feeling fatigued and tired. You can have symptoms of heart disease where people were able to do a certain amount of activity, but now they just feel more tired and are not able to do the same level of activity. So it's like, I think, shortness of breath, chest discomfort, feeling fatigued. Those are, I think, a constellation of symptoms that can actually signify underlying heart disease.
Yeah, and the good word is constellation. Start to look at them as a whole, and if you just get that sense something's off, go see a doctor. I mean, it could be a number of things. It could be even long COVID at this point, so that's why you need an expert like Dr. Kazi to be able to tell you what exactly is going on. And once again, getting back to what we said before, prevention healthy lifestyle. That is really the key. It's going to save you a lot of time and effort.
I think for men's health, I think it's also, we see so many patients that actually put off their symptoms.
Yeah.
So if you do develop some of those symptoms, the key is to actually seek care and go see a doctor for evaluation.
Please do. Doctor, thank you so much for taking the time.
Thanks so much.